Good day, folks. Alfie Vente here, once again of Vente Pain Relief Clinic and VPRC.ca. I'm hoping you're having a stupendous New Year, a capital S stupendous Happy New Year. I apologize, I haven't done a video of late. Today, we're going to do 4 awesome reasons why focus on the fascia during treatment. But before I go into that, please like, share, subscribe, pass it on to those that you feel this might be helpful for. We appreciate it and we thank you in advance. So, just to give you a bit of a background, the fascia is the connective tissue that lies underneath your skin. It wraps around muscles, bones, organs, nerves, tendons. It runs deep, it runs wide. It connects basically everything together. At times what can happen is if the fascia becomes tight, it can cause a lot of pain and discomfort locally and also further away from the local tightness. So why do I focus on the fascia? So let's start. Number 1. Decreasing tight fascia can help with issues such as chronically tight muscles and muscle spasms. So what I found over the years is that by releasing the fascia, it helps decrease those chronically tight muscles, muscles that tend to spasm. I found that it's worked for a lot of patients, and there seems to be more of a long-term effect when I work on the fascia to decrease some of the muscle spasms. Number 2, working on the fascia first before the muscles can result in better access to muscle tissue. Now, this is a strategy that I use. Like over the 21 years that I've worked as a massage therapist, this is what I've discovered. At times, muscles can be very, very stubborn, and they may not loosen up the way you want them to. People might be holding their shoulders really, really tight, and it's hard to get those tissues to relax. So what I do from a strategic standpoint is actually work on the fascia first. And what I found over the years is that if I work on the fascia first, the muscles tend to relax better. And that's important because if I want to access the muscles, if I want to access the deeper fibers of those muscles or the deeper muscles underneath different layers of other muscles, it's a lot easier for me to go in there, especially if the issues are fibers that are deeper in. So what I do is I may work on the fascia. It might take 10, 15, 20, sometimes I've done 30 to 45 minutes of fascial work to help get me into those muscle tissues. And again, just like number 1, I found that there seems to be more of a prolonged effect, positive effect after treatment when I work on the fascia first. So before I go any further with number 3 and number 4, as a Vente Pain Relief Clinic patient, you have preferred pricing access to our VPRC sequences. These are the self-care sequences that we have for your neck, for your lower back. These are videos that I have that show you techniques such as pressure points, such as massaging, stretching, so on and so forth to help manage your pain. So that's at vprc.ca, and again, it's preferred pricing for Vente Pain Relief Clinic patients. Number 3, let's go back to our list here. Working on local tight fascia may help with chronic issues further away. So, for example, you might have lower back issues, you might have hip issues, and what I will do is I won't necessarily start on the lower back or the hips first. I'll actually work on the feet and the calves. Usually what I found is like with people with chronic hip and lower back issues, there's a lot of fascial restrictions around the calf and the feet. So what I do is I work on the calf and the feet, and there seems to be an effect further up into the hips, the glutes, and the lower back. So if I were to start with the glutes and the hips and the lower back, especially if it's a chronic issue, what I've found over the years is that it's stubborn. It will not release. I've got to go further away to help release those tissues. And over time, as I've worked on the calves and the feet, the tissues do get a lot softer further up the chain. Number 4, treating the fascia may help prolong results of treatment results, especially if the issue is chronic. So this is just from my experience, and I'm not talking just like sort of working on the fascia for 5 minutes or 10 minutes. If you've got chronic issues, you might find that you're on the table, and yes, it can be fairly painful if it's really, really tight. I might spend 20 minutes, 30 minutes, 45 minutes on just the fascia alone to help release it. And what I found over the years is that there seems to be more of a prolonged effect in terms of the treatment results. And what happens is that the individual eventually comes back for more maintenance once a month or so, as opposed to coming in full blown for like a number of treatments consecutively. So those are my 4 awesome reasons why I focus on the fascia during treatment. If you've got any questions, please call us at 416-644-8894. That is our clinic number. You can also email us at admin@ventepainrelief.ca or alfiev@vprc.ca. Again, please like, share, subscribe, pass this on to those that you feel this might be helpful for. This is Alfie Vente, once again, at Vente Pain Relief Clinic and vprc.ca. Have yourself a great day and hope to see you soon. Take care.